And a day after the CDC revised its masking guidelines, public health officials are still wondering what exactly defines a hotspot. The CDC says anyone should wear masks indoors in hotspot areas, even if you're vaccinated.
Remember, they did say, masking indoors and outdoors, or indoors, vaccinated and unvaccinated, subject to local conditions. So that's the variable that I'm talking to.
Channel 3 Eyewitness News reporter Mike Savino is joining us live at the mobile newsroom in West Hartford this afternoon. And Mike, I know you spoke with the governor about this. What did he have to say about it today?
Well, he wants to talk with some other governors and with health experts about how we should be tracking this virus and what would actually make a hotspot. Now, if you remember back in the fall, we did have a metric that put some towns into red alert if they averaged 15 new cases per 100,000 people over a 14-day period. Well, now we have the vaccine, we have a better understanding of COVID, we're fully reopened. So the governor wants some flexibility where we can really try to monitor community spread and not just look specifically at cases. I also talked to some health experts who agree with what the governor is saying, that we need some flexibility, and also they agree that it would be good for the CDC to really tell local officials how they should be monitoring this virus.
Mike, you mentioned a little bit about the red alert system that we had last year, and yesterday, in fact, the Department of Public Health said that 2 towns here in Connecticut, Franklin and Sprague, actually meet that red alert threshold. Can you tell us a little bit more in detail about what exactly is happening in those particular towns?
Well, I talked with the first selectman in Sprague, in Franklin rather, Charles Grant, and he says that really what's driving that number up is there were 7 unvaccinated people in the last week that tested for positive. They're a very small town, so that those 7 people can really drive up that number. So for now, he says they're not going to be taking any action. They're not going to require masks in town buildings. They're not going to be changing anything. But of course, he is watching this. And the governor, again, to that point, said he wants more flexibility. He doesn't want things to be rigid. He doesn't want to just shut things down because of a spike in cases. And I think that's an example where public health officials say, we do want more context. We want to see if it's just some fluky spike in numbers or if you're really starting to see community spread before you start to impose more restrictions.